r/AskReddit. Doctors of Reddit, what's your best? They came in for a small checkup and ended up needing surgery story. I went to my doctor thinking I had a bladder infection. I felt like I had to pee every 5 minutes. Doctor found nothing but sent me for an ultrasound. Turns out I had a cyst the size of a grapefruit on one of my ovaries that was resting on my bladder. 5 days later I was in the hospital having my ovary removed. Same. Went to the ER with pain. They did a test and it was positive for a uterus. Gave me antibiotics and sent me home. Next day the pain just got worse. So I went back again. Couldn't sit, stand or lay down. Even after the initial pain management. Went for an ultrasound and they saw a cyst. Emergency surgery the next morning, and they tell me they took out a 2 kilograms cyst and my right ovary, as well as several little ones in the area. I've had several cysts lasered out since. Thanks. Goes. Same here except my surgery is next month. I kept thinking it was a uterus. Mine was a long road and I experienced a prolapse due to a large fibroid cyst in addition to the tumor. Solved the prolapse and constant urge to pee in 3 months with daily pelvic floor exercises. I had switched doctors because I wasn't getting the help I needed, but at least eventually my new doc got me to do an ultrasound. The female body is so complicated, anything could be happening down there. Glad your issues are over with. Not a doctor, but a paramedic of Reddit. When I was a brand new medic we got a call Sunday morning for 20-something-year-old male vomiting, with a small amount of blood in the vomit. I speak 2 languages, my partner at the time was from a former Soviet bloc country and spoke about 5 fluently. Believe me when I say this guy got cursed out the entire ride to his house in 7 languages. A 20-something-year-old called because he was throwing up. On a Sunday morning? Dude. You have a hangover FFS. We arrive and are met downstairs by his girlfriend who is panicking and confirms they went out drinking the night before. We roll our eyes, grab our gear and head upstairs. As soon as we see the patient our tone changes. The guy is Asian, but is paler than printer paper, soaked with sweat, is cold when I touch him and is barely conscious. I look next to his bed and a small amount of blood in the vomit is, in reality, a medium-size garbage can, almost 1/4 full of straight blood. His blood pressure is low, around 70/30. His heart rate is compensating by beating at about 160 times per minute. We get a big 4 in him and replace about a liter of fluid. His vitals improve, he comes around enough to answer questions. He says he drank 2 beers last night and smoked some pot. He says he has never been able to have more than a few beers without getting sick for days. I ask about his medical history and he says he has had general digestive issues his whole life but never anything like this, just has to have a low-fat diet or else horrific diarrhea. Bad hemorrhoids, low-grade abdominal pain constantly that has never been given a clear diagnosis. Nothing on paper to go from. We get him to the hospital and drop him off in critical. In one of my only true doctor house moments, as I'm walking out I tell the triage nurse exactly what the issue is. From the deepest depth of a half-slept-through lecture during paramedic school, I remember all these symptoms. He has an undiagnosed liver issue, which is causing blood flow through his liver to get back up. When the liver doesn't work properly, you can't digest alcohol or fat effectively. When blood starts backing up it causes portal hypertension which causes hemorrhoids and basically, hemorrhoids in the esophagus called esophageal varices. One of these varices has popped and he was bleeding out through his esophagus. One of the only times I have correctly diagnosed a problem beyond hey this drunk guy has been drinking alcohol. I remembered a second one. I teach an EMT class on the side and we were going through rare medical conditions that you can identify with little to no equipment. Your aorta is the biggest artery in your body and if anything happens to it, it's a big problem. It can develop an aneurysm, Think a semi-failure of the wall, causing it to balloon out to the side, pending full rupture. I'm explaining the ways you can identify this in the field, one of which is to take both the radial pulses, wrist, simultaneously. They should beat together. If they're beating off tempo, that can be a sign of an aortic aneurysm. I tell everyone to partner up and take both their partner's pulses so you know what normal feels like. A hand is raised in the rear of the room. U/Sam_Neil. My partner's pulses are wrong. I start by joking that students need to be more diligent in practicing taking vitals etc. until I take the student's pulses. Hers is indeed wrong. The head instructor and I go into work mode and do a barrage of other tests. She shows additional signs in a couple, but not all the tests. We advise her to go to the hospital immediately. We explain that if you have an aortic aneurysm and it ruptures while you are on the operating table of the most skilled surgeon in the world, your odds of survival are around 2%. She refuses and finishes class after we do SIA paperwork. She follows up with her doctor from childhood who, as she tells it, drags her by her ear into the ambulance he called. It turned out to be a very minor aneurysm, and she had a procedure to repair it and takes medication to keep her blood pressure low, but otherwise has a completely normal life. I was playing in an out-of-town sports tournament, and during a game I got hit in the ribs. The pain was so bad, I went to the hospital, thinking it was a broken rib and they would give me some 600 milligrams ibuprofens. After an X-ray they saw it was a pneumothorax, collapsed lung. Well, I did not understand what was wrong at first. They explained there was an air bubble outside my lung and I didn't think to Google the medical name, I just thought, that doesn't sound so bad. So when the doctor told me I probably need an operation and stay 5 nights in the hospital, I was like, what? But I am going home tomorrow? The doctor said I can go if I really want, but I have to sign this paperwork, and that was the first time I understood this is actually a serious injury. Luckily I live in Germany so I wasn't worried about going bankrupt. But in my case I just didn't understand how dangerous the situation could be. Once I did, I quickly agreed to stay. I'm a graduate student, and a few years ago I fell about 6 feet onto concrete, stopping my fall with my knee, elbow, and skull. The area above my right eye swelled up, I looked like Quasimodo, and it took over a week for the swelling and then awful bruising to go down. The light sensitivity and memory issues lasted for over a month. Even now, the area above that eye feels a little different than over the left eye, and I don't think my short-term memory is what it used to be. And I didn't go to the ER, because, though I had insurance, it was awful and I thought I was just shaken up, not concussed. It was a stupid, horrible, absolutely insane decision, and I am lucky that I did not have a brain bleed and die. Universal healthcare, or at the very least intense healthcare reform, is desperately needed in America. Not a doctor, but I worked in an emergency room in the nursing school. I was sitting out in triage late one night. My nurse had run to the back for a minute and a guy comes in. The only complaint was a sore throat. Nothing else at all. Just a sore throat. But something was off. He had a slight grayish tone. As a tech, I figured why the hell not. Told him to follow me and took him to our EKG area. A few minutes later, my nurse comes back and is looking at me like I'm nuts because I'm doing an EKG on a sore throat. I handed her the printout and she had an oh shit look. He was having a steamy, massive heart attack. My charge nurse came out later after the dust had settled and asked me what made me check him. I told her I didn't know, he just didn't look right. Intuition can be a funny thing. Poor guy. He was slightly confused about the whole thing, he just wanted something to fix his throat irritation. Friend of me had a similar thing. Just didn't feel too well. Looked up symptoms in Google. Google said, there might be a slight chance you have a heart attack. Goes to emergency. Like it's probably nothing, but since I read that on Google Docs, do a check and guess what, he was having a heart attack. Immediate bypass operation, 1 year in recovery, after which his employer gave him another, less stressful job. In my doctor's office is a poster warning against using Dr. Google. I always think, yeah, fuck you. My friend would have been dead without Dr. Google.